Russell, we need to start.
Are you ready? It's time out.
I'd like to bring to order this meeting of the Dade County Hospital District Board of Directors. We'd like to start with, Chapter 7, giving our invocation.
Hi, y'all. My name's Doug, staff chaplain for Medical Center Health System. I told Mr. Kippen, I've got the COVID numbers this afternoon. I about jumped out of my skin because I realized what a great staff we have and best practices and hard work, and I'm just so proud of them. You get close enough to my badge, you'll see my badge says staff chaplain, so I've kind of got a soft spot in my heart for these folks. Let's pray. Father, we love you, we appreciate you, and we certainly do thank you. We pray right now that you would just continue to have us to perform the way that we're to perform as professional caregivers, and we'll just pray that you would take and have us to be the leaders in this part of the country right now, and to become the leaders in this country that you would desire for us to be. Father, I pray a special prayer over each one of our staff members. I pray for the doctors, I pray for the nurses, and all those that's been, Lord, just lead us and guide us and direct us, and we're going to give you all the glory in your holy name. Amen.
Amen. Thank you. Would y'all stand with me for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The Texas flag. I honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you. If y'all will let me, I'm going to ask for the family of Joe Guerrera, and we're going to get out of order and handle this now, if that's all right with y'all.
If we will, Mr. Chairman, Joe's family is out in the foyer, and I think we're going to have too many bodies in here with our situation, so if we don't mind, if we'll move this out to the foyer area right quick and make this presentation, and then we'll come back.
Sure. Let's do that. A lot of support out there. Thank you for letting us make that change and doing that, and thank y'all for doing that for him. Okay, yeah, next, we're gonna start with our awards and recognitions.
Before we move into that, yes, thank you for that. Unfortunately, I'm sad to report we have lost another one of our team members last week. Another long-term employee here. We will be recognizing her as well. She makes our third employee that we lost during this COVID situation. So please keep all our staff, and this lady was in IT, Sarah, Olive, and she was great. And I'm already hearing people see an email saying, well, if she was here, she'd already have this problem fixed. And so for our IT team, that's a big loss. That's a tight group over there. And you lose one out of there, you're losing somebody you're in contact with all day, every day. So please keep them in your prayers as well. All right, let's move on. On our awards today, we want to recognize our Nurse of the Month for February. And our Nurse of the Month is Heather Buckhalter. Heather, are you here? Come on. Did I miss a name, Heather?
That's all right.
All right, let me read a few nice things about you. Heather has been an instrumental part of the team, even with all the challenges that COVID has brought her way. Having to step into a role of a charge nurse in the overflow COVID area and completely, despite all that, and the challenges thrown her way, she keeps a smile on her face under the mask, of course. Right? She's committed. She serves as a resource for all the staff and spends hours teaching new staff how to handle the COVID patients and how to maintain a positive attitude. That's what I like the most. Even though she's had to endure the heartbreak and mental anguish over and over of losing COVID patients, despite the team's best effort, Heather keeps showing up and has shined a light on a difficult situation. Once again, you have people that come along that are a light in the darkness. That's it. She's in there day in, day out. Heather, it is my honor to present you with the Nurse of the Month, and thank you for what you do for Medical Center, and more importantly, thank you for what you do for our patients. Let's give her a warm round of applause. Thank you, Heather. All right, now we have our non-clinical associate of the month, February. I don't know how this happened at all, but this says this is going to go to Terry Mercer, the ECHD police officer. Terry, come on. I'm going to struggle through this and try to say something nice. This guy consistently goes above and beyond to make sure that medical center health system is safe. He assists our employees and patients in tasks that normally wouldn't require a police officer. He is the first to aid help to anyone and everyone, no matter the circumstances. During this crisis, he has volunteered to work whatever and whenever we've needed, with no questions asked. He is a go-to officer. You can find him often talking to patients and families and comforting them during their time of crisis. We, our medical center, is a better place because we have a person like Terry in our police department. On behalf of all of us, thank you, man. Congratulations.
Thank you.
You're making me nervous. Thank you, Chris.
Thank you. I appreciate
Is
it.
your family here?
My wife and my son.
Wife and son, say hello.
I appreciate it.
Thank you, man. Appreciate it.
Thank you, guys.
Thank you.
Thank you.
All right, we've got one more. Who is? Chris is? Okay, Chris. Come on, Chris. Y'all know Chris Tovar. He works in ProCare. It's not Chris, but it's somebody he works closely with every day, and this is Trish Snow. And she is the ProCare clinical manager, and she is a rock star. Would you agree with that?
I agree.
I'll read a few things, and we'll try to say something nice, and even though she's not here, but she has helped to establish the Urgent Care Division COVID-19 clinics. She's helped us establish operations framework to support the volume and staffing needs, including bringing on hospital furloughed personnel and those who had hours reduced to other departments and department closures. She has helped maintain the supply costs and improve part levels to maintain enough inventory. I can tell you, I spent a lot of time, Chris and I both have, with Chris and Trish. And Trish has yet to not blow our doors off. She has been fantastic. I know anytime I've got something big, the first person I turn to is Kristen to get it done. I know Chris turns to Trish to make that happen. So he's here on her behalf to accept this award tonight. Will you please give her our most heartfelt thank you and tell her job well done, and we truly appreciate it.
Absolutely. Absolutely.
Let's give her a round of applause.
Okay, group, I'm gonna go out of turn again, and I'm gonna go ahead and read our mission statements. I didn't have one up here, so I've got one now. I'll read that for us. Our mission: Medical Center Health System is a community-based teaching organization dedicated to providing high-quality and affordable health care to improve the health and wellness of all residents of the Permian Basin. Our vision: Medical Center Health System will be the premier source for health and wellness. And our values are I for integrity, C for customer-centered, A for accountability, R for respect, and E for excellence. And I apologize again for getting things out of turn, but we're going to get back into it.
Mr. Chairman, if you would please excuse me. I am feeling a little bit under the weather from my COVID shot yesterday, and I think y'all can take it from here. Are y'all good with that?
We're good with that.
And please pray for me and get through the night. But I'm trying to be brave and tough, but my trailer is heavy, so I'm going to shut it down. So
Thank you.
Just have one thing to say. Yes, sir. Suck it up.
Yeah, please.
Thank y'all very much.
All right, next we're gonna, next conflict of interest disclosure by any of the board members. If any board members has any conflict of interest, they can disclose that now. Hearing none, I'm gonna go forward. Public comments on agenda items. Now would be the time. If you are out there and would like to say anything, you'll need to get your information to one of the girls up front. Is there anybody that we know of? Don't see anything, so we're gonna move forward. Okay, next from Ms. Allison, a check presentation from the Human Being to MCH Foundation.
Thank you. We are very excited. This is our, I believe, 4th year that we have partnered with the Human Being. They have a day of caring back in October, and it is for breast cancer awareness. And every year they have been able to present us with a check from that day. 100% of their proceeds from that day come back to the foundation, specifically for our patient navigation program and breast cancer. So this year we're very excited to welcome Maurice Turano with the Human Being, and they are presenting the foundation with a check for $10,920.
All right.
Chair, and wish I could take credit, but it's really our community. I'm just so impressed with the generosity of Midland and Odessa mainly, and we're going to have West Odessa shortly, and so we're going to keep bringing more money.
Good.
Thank you. And I should say, I just want to add one small thing. We get asked almost every month or every week, do you want to donate to this or that? And we have been saying the same thing now for a couple of years. We want to focus our giving. We want to have impact in our giving. So we almost exclusively, we help some things off the record with some small clubs and stuff and sports teams, but this is our main charity, and we want to support you guys going forward. So we're happy to keep growing this number, so it keeps growing.
Thank you.
Thank you.
Great work.
That's pretty amazing. That's no small chunk either.
It is.
Okay, let's go to our consent agenda. Everything listed under consent agenda has been there for you to look over. If anybody has any questions, we'll talk about it. Otherwise, I'll entertain a motion.
Make a motion.
Second.
Have a motion and a second. Consent agenda, all in favor, say aye.
Aye.
Any opposed, say. Motion carries. Committee reports. Ms. Green, Finance Committee.
Finance Committee met today at 4:45 prior to the board meeting. Mr. Brown, Charlie Brown, reviewed the quarterly investment report. The Finance Committee approved the quarterly investment officer certification, the investment policy annual review and approval, and we also approved the financial report for month ended December 31st. And 2 capital expenditure requests that are listed on the agenda, and I would move to approve the Finance Committee report.
Second.
I have a motion and a second. Any questions from anyone? All in favor, say aye.
Aye.
Opposed, the same. Motion carries. Texas Tech, Permian Basin report. Dr. Benelini, how are you today?
Well, and you?
I'm well, thank you.
I'm glad. I'm going to have Dr. Martin Ortega, who is my assistant dean for graduate medical education, give you the annual report that are required by the ECHD.
Okay.
So
Thank you.
Here's, all right, thank you, sir, appreciate it. Hello, everyone, thank you so much for your time. My name is Martin Ortega, as Dr. McElwain was saying, I'm a family physician by trade with Texas Tech, and have the privilege to give you guys an update for the academic year of 2019-2020 from the graduate medical education program that received part of their training here at Medical Center. Actually, I'm thrilled to be able to give this report. I think part of it is very easy because I'm proud to be able to give you guys some updates on this academic year, which, looking back, allows us to reflect and to celebrate some things together, and hopefully also serves as a springboard for furthering our partnership, our relationship that I think is now 47 years strong. So this is a representation and as an update to the 4 residency programs and 5 fellowship programs based out of Texas Tech with Medical Center partnership. Just want to quickly go over them because I know your time is precious and there's other things on the agenda. This past academic year, we were able to celebrate 13 graduates from the Texas Tech Family Medicine program with a board pass rate of 100%. Under the family medicine umbrella, there's 3 other fellowships for that academic year, including hospital medicine, geriatric medicine, and ER fellowship as well. There was 2 graduates of the geriatric fellowship program, 2 graduates from the hospitalist fellowship program, and 3 from the ER fellowship program. There is a board exam that's associated with the ER fellowship, and that was also 100%. There were 16 graduates from the internal medicine program, 2 graduates from their endocrinology fellow. Both of those programs, both the residency and the fellowship, also had 100% board pass rate. There was 3 graduates from the obstetrics and gynecology program, 100% board pass rate there as well. 1 graduate from psychiatry, and they had 5 residents transition over into the fellowship. So I think that bodes really well for the training that they receive in partnership with Texas Tech and Medical Center. And I think it speaks to the mission of both institutions, right, being a community-based teaching institution. So again, want to thank you for your continued support. And also, like I said, I'm very proud to give you that update. I know that Mr. Tippin, mentioned the whirlwind that has been this past year from March of 2020 on. And I'm very proud of how we've been able to work together. And on that front, I think if I may have just a little bit more of your time to kind of speak on the impact that this relationship carries, not only in terms of fund of knowledge, right, and graduating capable, compassionate physicians, many of which actually turn around and practice here in West Texas. I think depending on the program, depending on the year, that can range from anywhere from 15 to 30% of graduates from those programs have stayed on to practice here in West Texas. But I think that beyond the past reflection and also the future investment, I think there's also a very present value to having these resident physicians that, again, like I said, I'm proud to represent for you this evening. Since March, and the creation of different protocols to be able to take care of patients, both generally speaking and also those under COVID care, 95% or greater of every single COVID admission at this hospital has been taken care of by Texas Tech physicians, either in the ER, on the COVID floors, or in the intensive care unit. Speaking as someone who's going to start another week tomorrow, there's nobody more thrilled to see a number of 45 census, because I think that that's taken a very committed effort from our physicians, but also a very concerted partnership. Because what has allowed us to do that is working hand in hand with the hospitalists here at Medical Center and the different groups of physicians, both in the ICU and within our own teams in internal medicine and family medicine. I think that, like I said, this speaks to the ongoing care, right? That at any given day, total census of this hospital, anywhere from 30 to 40% of the patients could be taken care of by Texas Tech physicians, whether that's in the COVID unit or in the ICU, but beyond that, right? By our pediatricians in the NICU, by our obstetrician and gynecologists in the labor and delivery unit. Again, like I said, that partnership hopefully is one that can go on further and further. I wanted to be respectful for your time, and like I said, just wanted to give you both academic and patient care updates for our partnership. And again, I thank you for your time, your attention, and your continued support.
Thank you very much.
Thank you. Appreciate that. So next, I would call for a motion to table CEO reports.
There are several things there's a couple in the review.
We need to?
Yes.
Are you prepared?
I can talk to at least the one I know to get through is the network incentive program within the CEO report.
Okay.
And then Matt, are you prepared to, is Matt here? I saw.
Yeah.
Yeah. He can talk to the strategic planning.
Okay.
We've always
All right,
got
well,
a
then we'll just
person
do
that.
that.
So I'll let him do the strategic planning update first.
Okay.
Not to put you on the spot.
There you go, man.
I didn't really prepare a speech, but so as you know, we've been working on strategic planning in various venues and styles for the last couple of years. We met in the fall, I think it was in October, and put together a plan. The executive team continues to work on those plans, and we'll be prepared to present an update for all of those in the upcoming retreat in May. What are the dates before? Is it 20th to the 22nd? So hopefully everybody has responded to Michaela with room choices and all of that. We'll be regaining our tradition of doing that in Marfa, Texas. For those of you who have not participated in that, it's a very nice venue and a good time to get away and talk through these things. So we'll be going through an update. We'll be looking at some market analysis that we're facing as an organization, and then just putting together more plans, facilitating agreement, and prioritizing some action items for our future. So again, that's May 20th through 22nd.
Okay.
Any questions?
No.
Thank you.
Very good
Well done.
report.
Okay.
Well done.
The other thing we should have in there, Mr. Chairman, is a memorandum related to some new programs that Dressette and Lorenz will help manage. I don't know if that's in the packet or not. It should be. Just a little background. As you know, our Medicaid supplemental payments are in the area of around $30 million a year. Part of that is the DSRIP program. The DSRIP program has been scheduled to phase out. Next year's is the final year for that. Recently, Texas has, through HHS, been awarded a $11 billion Medicaid supplemental program improvement over the next 10 years. Part of that, though, about $5 billion of that is related to a new program, and it's a new acronym, CHIP or something, and it's another. We got to go through a bunch of motions to get the money, basically. Within the Permian Basin, between us, Midland Memorial, and Odessa Regional, it's estimated there may be upwards of $25 million available to us on an annualized basis. The The risk, though, is that this is a new access to funds, and therefore, we've got to submit plans to the state to see if it will meet their approval, and will be approved also by CMS. So there is a chance that our access to these funds may not be available, but if we get on it and get on it quick, hopefully we can get an additional quality program or quality programs put in place that as DSRIP phases out, the SHIP program will phase in. For our side, we think that there's probably $10 to $12 million potential in supplemental funding that we could get. Drissette and Lorenz is our lobbyists / attorneys to help us access this, create the program, submit it. They put together a proposal to us with a program fee of $300,000 plus an hourly fee that I estimate to be roughly $50,000, or an all-in cost of around $350,000 a year. They will help us manage the program, access the funds, make sure we hit the qualifications, so on and so forth. And so we're, in essence, having to spend $350 to try to get $10 to $12 million. Now they've got in their, there's two important pieces that I think that in their original proposal they had to us, since it was for the full Permian Basin, they wanted us to be jointly liable for the others that are in the program. I said we cannot. As a taxing entity, we can only be responsible for our share. So they've revised their proposal so that it's just us. If the others don't want to participate or don't pay, it's not our responsibility to make good on that. They've also put a provision in there that if this program doesn't get approved or does not get approved to the level that we anticipate, they will keep their program costs capped at no more than 15% of whatever we get. So if it only turns into being $1 million in additional funding, that $350,000 fee will drop to $150,000. So at most. So there is a cap on how much they can do. I've also asked them, they asked for original 5-year contract. I've brought it down to 3. Again, staying in line with our requirements as a board. We really shouldn't have contracts more than the length of any of the directors here. So 3 years is the most. But I do put that forth to the board, asking for approval to enter into a contract with Drissette and Lorenz to be able to have them start this new funding source documentation and go through the approval process.
Okay. Any questions?
No.
Entertain a motion.
Make a motion for approval.
A second.
Have a motion and a second. All in favor say aye.
Aye.
Opposed the same. Motion carries.
Thank you.
Anything else, Kristen, or anything else?
No, I can give you a quick update on the boosters. Those are, they are coming. Most boosters for the Pfizer vaccines do not start until the week of Valentine's Day, so let's say the 14th and 15th. So we'll be releasing that to the community so that they know which clinics we're going to, what the times are, scheduling information, all of those things, the end of this week and or Monday, so that everyone will have that. We're running a test through on Friday the 12th, so we'll make sure that it flows very well with these clinics, and that way we don't run into any stuff like we did out of, not like the test run so it runs smooth like we did out at Raleigh. We start again tomorrow, Wednesday, Thursday, Friday, as long as we have vaccine. We gave 500 to Andrews, 150 to Odessa Regional out of this week's allotment, and we're working with the health department and ORMC on next week's allotment so that we can all three partner together to cover all of the educators in the Odessa Ector County area, to include even down to some daycares, just because we want to make sure that we knock out that group too, and they've all said that they would help make sure that we can get that done. We will be out at Ratliff again, if you guys want to stop by or see anything. and then the boosters downstairs. They came to an end yesterday, but we still have probably 100 plus or minus the people that still need those vaccines. So Linda's working on getting us a report where we can call those people and say, hey, you haven't got your booster. We've got to get you in here. So we'll be setting up another couple of days with limited hours just to try to get some of those stragglers in. And that way we're not wondering where they got their second doses. I think total that we submitted in our 5-6-day stint out at Ratliff was 4,834. Is what we submitted to the
So that's going to be a big number for follow-up.
So the way that we have worked through things with our ProCare team is to do about 8 to 1,000 a day. So we worked through a lot of flow and rooms and scheduling. So I do think that we can get at a minimum 800 between the clinics that we're going to use.
So the second round of the stuff that's been out at the stadium will go to a clinic?
Yes.
Okay.
Our last day out at Ratliff Stadium is February the 26th. So we're really trying, because we know that our resources cannot continue to be pulled out there 3 days a week. So we're really trying to get it back closer into campus, and then that way people can go at their leisure 7 days a week, 12 hours a day, that sort of thing. I think it'll make everyone's life a little bit easier. And then we're still talking through if the boosters and the primary shots are too much for the ProCare clinic, or those few that we're going to use, how could we partner with ORMC to make that look a little bit different for our community? So we're still working through some of those logistics, but we will have some solid plans in place to be away from Ratliff Stadium, closer to home, and doing pop-up locations in those underserved areas by the end of the month.
Okay.
I just want to say, Kristen, what an amazing leadership. I mean, I know everybody in the community is just so impressed with the way you all have handled this, and being out there in the wind and in the cold, and pushing through all those people and wrapped around all the way to the loop. I mean, such phenomenal work. And I just have to applaud you on that. Such a wonderful professionalism. Thank you so much for what you do.
Everybody's gotten calls. That's amazing.
And that team has done some really phenomenal work out there.
Trevor as well, man. Rock on with all the live updates, and then just keeping everybody informed and transparent. And that's just, it's good. We couldn't ask for anything better. Y'all doing great.
No, it's actually
Yes,
great.
thank you, Trevor, because I get calls and texts and I'm like, hold on. I know you're up there constantly updates, so I'm like, okay, yes, here, this is what you need to do.
Great work.
Medical center has definitely stood out.
Yes.
Oh, yeah, great, absolutely. Done a great job.
And there was a news article about board members going to the front of the line.
Mhm.
And I just want to clarify that for the record.
Mhm.
Some of the board members may have, I don't know, but none of that happened at this hospital.
Right.
Yeah. Yeah, it is. So, our next item is, order of election. Is Steve still on the phone? So would it be adequate for us to put that off until?
Yeah, can you guys hear me? Now, we need to do it today.
Okay. Well, I knew we needed to do it. I was gonna see if we needed to put it off till after executive session, but if you can go ahead now.
Either way. Either way.
We're ready for you. We're ready for you.
Okay. Well, as y'all know, it's that time of year for our call for elections. It's going to be for districts 1, 3, 5, and 7. Election is ordered to be held on May the 1st of 2021. Applications for a place on the ballot are due by 5 p.m. February the 12th, which I believe is next Friday. There'll be an early voting period, which will begin on April 19th, and it will end on April 23rd. This order of election has signature blank for all of our board members that y'all will need to sign. There on the bottom, it'll be dated today. We will get that on file.
Okay. So if that's all the information you have for us, then
Yes, sir.
Okay, I need to entertain a motion.
Make a motion.
I'll second.
Motion and a second. All in favor, say aye.
Aye.
Opposed, same. Motion carries. And before we go into executive session, I'm going to do a roll call since we've got everyone here. Ben Kiros?
Here.
David Dunn?
Here.
Mary?
Here.
Wallace?
Here.
Dunn? Richard?
Here.
Brenda?
Here.
And Don Hallmark here. Okay, we're going to go into executive session, meeting held in closed session involving any of the following: consultation with attorney regarding legal matters and legal issues pursuant to section 551.071 of the Texas Government Code, and deliberation regarding negotiations for health care services pursuant to section 551.085 of the Texas Government Code.